Hi everyone, my name is Kim. This afternoon we're going to talk about another personality disorder, and it's avoidant personality disorder. Now, avoidant personality disorder is people who have this. They want to connect with people. You know, they want to make friends. They want to have like a support system, with friends or just, people that care for them. But these people, they avoid people because they're afraid that when they get to know people, that people will expose who they are, private things that they may have shared with people whom they thought they trusted. So these people, they want connection. They want to have friends, and that sort of connections. But they're just very cautious. They if they make friends with people and get to know people, and they open up to them because they think this person is has their best interest in mind, and so they have said some personal things to their friends, their so-called friends, but they in their mind they realize that they shouldn't have done that, talking about themselves and their life and personal things, because they feel that people will take advantage of them. And so that's one of the reasons why they remain just like a loner. Like schizoid personality disorder, people who are that disorder, they don't want anything to do with people, and that is a choice they've made. And it's such a stark contrast to people that are avoidant, that have avoidant personality disorder, because they want to form connections. They want to have a support system. They're vigilant, and for that reason I just mentioned, they're vigilant. They don't want to be taken. They don't want to be taken advantage of. So that's why they're very cautious, very vigilant. These people, so they because of these reasons, they're often alone, and they don't want to be alone. They want to have friends. They want to form strong connections. These people, they have social anxiety, so it's hard for them to make friends, or to be in social situations. They can get really anxious, and to the point where they just avoid all social situations, which is, they don't want to do that, but the anxiety is so strong that they have to avoid social gatherings. Now these people with avoidant personality disorder, they they do want validation, also, as they're connecting with people. They want validation. They want validation from their friends. But at the same time, they may think that people are going to, behind their back, mock them, be critical about them, or just say really, mean things or negative things. And so people with avoidant personality disorder, they always feel like people are mocking them, being critical towards them, just not being nice to them. And because they feel this way, that isn't always the case. People that they meet and want to form connections with, it isn't that way. But in their mind, they feel that this is happening when it's not really happening. So they have low self-esteem. Social anxiety, thinking people are mocking them or don't like them, or saying negative things about them. Those all point to low self-esteem issues. They lack the confidence. They're fearful people. They're very sensitive. So if there's a slight, maybe a smirk or something, like a negative facial expression or something that they, think that this is what they're seeing, they're just going to go. They're gonna bolt, and avoid these people who they think are doing these negative things towards them. So I'm just going to make this a short video, but so these are some of the symptoms of avoidant personality disorder. So yeah, like I said, they are so different compared to people with schizoid personality disorder. Schizoid personality disorder, people like that don't care about connecting with people. They don't. They like their life being a loner. With avoidant personality disorder, with people who have this, they don't, by choice, they don't like living alone. They want to form, strong connections with people, have a support system. This is what they want. That's important to them. Whereas schizoid, people with that disorder, they don't care about that. That's not important to them. Making connections with people is not important to people who have schizoid personality disorder. Now I'm going to talk about treatment. So treatment for this disorder, they can take medication for their anxiety. There are medications out there that can help with the anxiety. And, for example, diazepam is very good for people that, suffer from anxiety. And so when they're prescribed that by a psychiatrist, and taking that, it will help them to calm down. It will calm them. And, you know, the point of taking diazepam, this medication for anxiety, it's to help them not to be anxious. It takes the anxiety away. They're calmer. It means the medication's working. And so they will be able to go into a social situation and not feel so uncomfortable or anxious. So that's one treatment for them. Another treatment for this disorder is they can go to a therapist that specializes in cognitive behavioral therapy. Very good therapy for people with a wide variety of mental illnesses. Very good therapy. It definitely helps. It works. Also, psychotherapy, that can help too. Both therapies can help. They want to, the therapists, they want to pinpoint, why this person feels this way, what is going on in their life. And so the whole point of it is that it's helping their patient, the person with this disorder. It's helping them to, they're going to give them the tools they need for their disorder. They're going to get the help they need, the tools that will help, with this disorder. And it's very hopeful. These people can get help. They can, the therapy will help them to be more confident in themselves, and along with the medication too. Both good treatments, and getting this person with the syndrome, back to not feeling anxious, but to go into social situations and connect with people, but doing it in a healthy and a confident way, but at the same time they're feeling calm, so they can do those things. And it's good for them to get out and socialize and make connections, because they have low self-esteem. Doing these things will make will help their self-esteem to be better, and they'll just feel more confident in their life and in the social realm of things. All right. I thank you for watching my channel, and I hope that this information is informative for you and you can learn something. And I hope you have a good rest of the day, and I'm going to say goodbye.